Based on the Harvard Gazette article published on March 20, 2026. New study links increased immigration with lower elderly mortality. A new study by researchers from Harvard Medical School, MIT, and the University of Rochester has found a significant link between immigration and reduced mortality rates among older adults in the United States. The research, published as a working paper in February 2026, shows that adding 1,000 immigrants to a metropolitan area reduces elderly mortality by about 10 deaths compared to what would be typical. Why immigration helps? The key reason, according to study author David Grabowski of Harvard Medical School, is that immigrants fill critical shortages in the U.S. healthcare system, particularly in long-term care. The study finds that for every 1,000 immigrants arriving in a metropolitan area, there are an additional 142 foreign-born healthcare workers, including physicians, nurses, and especially aides for private homes and nursing facilities. Immigrants add, not replace. A crucial finding is that foreign-born healthcare workers do not displace native-born workers. Instead, they add to the workforce. Increased immigration leads to a net increase in long-term care workers, not competition for a fixed number of jobs. Furthermore, the expanded labor pool does not depress wages. It's additive, not substitutive. Grabowski said, it doesn't crowd out anyone's jobs, and it doesn't appear to lower wages at all. The current role of immigrant healthcare workers. The paper highlights that immigrants already play an essential role in U.S. healthcare. About 18% of all healthcare workers are immigrants, including roughly 195 nursing home workers and 1 in 3 home care workers. Why fewer deaths occur? The reduction in mortality is linked to the ability of older adults to age in place. More home care workers allow seniors to remain in familiar environments closer to family and friends, which leads to better mental and physical health outcomes. Institutional settings like nursing homes can increase risks of infection, weight loss, and hospitalizations. When you're in the home, your mental health is better, Grabowski noted. It's where everybody wants to be. Policy implications. While the study was conducted over several years and not as a response to current politics, it has clear policy implications. A 25% increase in national immigration would reduce elderly mortality by about 5,000 deaths. If limiting overall immigration is a priority, the researchers suggest creating special visas for foreign-born healthcare workers, given U.S. demographic trends, with fewer younger workers to care for a rapidly growing older population, the workforce shortage will worsen. Either we draw more native-born workers into this sector, or we greatly increase our efforts to attract foreign-born individuals, Grabowski concluded.